We'll move on to the next cardiovascular disorder, that is angina pectoris. It is asked for 10 marks. Now, commonly, the most important part is the definition, and even it is asked for the viva. Okay, types of angina will be asked for 5 marks. Okay, then along with that, nursing care plan is asked, and immediate management of angina pectoris, that also. Okay, now under this angina pectoris surgical management, that is already discussed. Okay, when I have taken coronary artery disease or coronary atherosclerosis, I have discussed the entire surgical management. So I will not be repeating it in this class. So you can refer the CAD notes. Okay. So we'll move on to the topic angina pectoris. So remember, whenever we tell angina pectoris, it just means chest pain. That is because of myocardial ischemia. Now, already all of you are aware what is ischemia. That is, there is decreased blood flow. Okay, when there is decreased blood flow, there is decreased oxygenation also. So, because of the decreased blood flow, that results in chest pain. Okay, this is related to the heart. Okay, that is called as angina pectoris. So as I told, what happens is mainly because of the insufficient blood flow. That is because of ischemia, this chest pain is occurring. Okay. So you should know that angina pectoris is just a symptom that you see in the patients. Okay. So because of some cause, the person may be getting the angina, okay, or the chest pain. So before starting with the angina pectoris, we have to know what is the term angina and what is the term pectoris. Okay, it is taken from the Latin word. Now the word meaning of angina means anger, which means to strangle. Okay, and pectus, you know, it means chest. Okay, so that is why it means uh, strangulated type of chest pain. Usually a patient who is having this anginal pain or even in myocardial infarction, they will be just folding their chest, or they will just fold their heart, and they will tell that it is like a pushing, squeezing type of a pain. Okay, the pain is very, very severe, and they will tell as if it is like a heaviness, like a weight is there on the chest. Okay, like a crushing pain. They may cry like that. Okay, so that is the exact feature of anginal pain, chest pain. Okay. Now, one more main difference you may get confused is what is angina and what is MI. Okay, before starting only, I will let you know. Now, angina pectoris is because of ischemia, that is because of decreased blood flow and decreased oxygenation to the heart. But myocardial infarction or MI or heart attack is because of complete necrosis to any part of the heart. Okay, so ischemia is there for a prolonged period of time that will result in necrosis or death of the tissue. That will cause myocardial infarction or heart attack. Please remember that. Okay, so that is the main difference between angina and heart attack. Okay, and always remember that this angina is a precursor of MI. Before MI occurs, usually most of the patients may have this angina pectoris. Okay, so we will move on to the introduction. So as I told, angina pectoris is a clinical syndrome which refers to episodes or attacks of pain or pressure on the chest. And usually why it occurs is, why this chest pain occurs, it is because of the imbalance between the oxygen supply and demand. Okay, there is decreased oxygen supply and more demand is there. Because of that imbalance, usually the patient experiences chest pain. So already I told it is taken from the Latin word, isn't it? The word meaning of it is strangling pain in the chest. Okay. So just if you cannot remember anything, also remember angina pectoris means chest pain that is occurring because of myocardial ischemia, that is decreased oxygen and blood flow to the heart. Again, moving on to the definition. Angina pectoris is the chest pain resulting from myocardial ischemia. Okay, ischemia means decreased blood flow. So this is how the patient will be bending forward, will hold the chest and will be shouting and telling that they are having a squeezing or tightness in the chest. Okay, remember it is very, very severe. Okay. Next is the most important thing, that is types of angina. Please note down, it is asked for 5 marks. Okay. Now we have got so many types of angina. We'll see regarding each one of it in detail. It's very easy also to remember. Stable angina, unstable angina, variant angina or Prince-Metal's angina. Next is nocturnal angina, angina decubitus, intractable angina, post-infarction angina. Sometimes they ask for 2 marks. Okay, you have to list down or explain 2 of it. They will ask for 5 marks, you have to explain all of it. Okay, because students write lot of blunders. It is easy, I am telling. Please go through the notes and please write down the notes also. Okay, so stable angina. So as a name suggests here, stable angina. Okay, it is a type of angina or chest pain which is having a regular pattern. Okay, it is a regular pattern and it is occurring because of a predictable degree. Okay, we know that it can be predicted here. Okay, this type of angina is because of a predictable degree of exertion. Most of the time whenever you're doing physical exercise, physical activity, walking, or because of stress or emotions or anger, during that time you get this stable angina. Okay, remember that stable angina is a type of chest pain which is predictable. Okay, because of it is usually because of a predictable degree of exertion, that is because of exercise or because of stress or emotions, and it is of regular pattern. Okay, it is having a regular pattern. And always remember, stable angina is relieved after rest. Okay, suppose you are doing activity, you got chest pain, you are taking rest, immediately it will reduce. Okay, and usually it will also get relieved after taking nitroglycerin. Okay, so that is about stable angina, and stable angina is the most commonest type of angina. Okay, and most of the time it is seen that this type of angina occurs because of the what we call the plaque or atheroma deposition, or because of stenosis it occurs, or because of atherosclerosis, or because of the weakness in the muscle wall. Okay, or because of hypertension, cardiomyopathy, stress. Because of all these reasons, stable angina usually occur. Okay, so that is stable angina. Okay, I'll just repeat. Usually it is of regular pattern, it is relieved after rest or after taking nitroglycerin, and it is because of a predictable degree of exertion like walking, after exercise, or after stress. Usually you will get this type of angina. Next one is unstable angina. It is just the opposite of stable angina. Okay, there are some other names for unstable angina like crescendo angina, pre-infarction angina. Okay, because usually this unstable angina occurs before heart attack. Okay, now I told it's just opposite of stable angina. It is not of a regular pattern. Okay, stable angina was of a regular pattern. This is not of a regular pattern. One more thing is, it is usually triggered by unpredictable degree of exertion or emotion. Okay, it is unpredictable type. Okay, and next is, this type of angina is very serious or dangerous type. Emergency it has to be treated, because usually this type of angina increases in duration and severity. Okay, it will increase in duration and severity, that is why it has to be treated emergency. One more is, like stable angina, this angina don't think that it will be relieved after rest or nitroglycerin. After taking rest or after taking nitroglycerin, unstable angina will not be relieved. Okay, that much you have to remember. So that is the main difference between your stable and unstable angina. Next one is variant angina or Prince-Metal's angina. Now, variant angina or Prince-Metal's angina is mainly because of the spasm of the coronary artery, and commonly it is seen in patients with smoking and hypertension. Now, this Prince-Metal's angina can occur at any time. That means it can occur at rest also. Okay, it can occur at any time. It can occur at the time of rest. Commonly it happens in between midnight to 3 a.m. Now the reason why it happens in midnight to 3 a.m. or occurs during the time of rest is because the blood flow will be restricted. okay, during this time. And one more is, while the person is lying down, what will happen? The gravity will redistribute the fluid. Okay, the gravity is redistributing fluid in the entire body. And what will happen? The heart has to work hard to pump the blood. So there will be decreased cardiac output, and because of more workload on the heart, chances are there that person may experience chest pain, okay, at night time. That is a major reason most of the heart attacks or chest pains that occur is at night time. Okay, that is Prinzmetal's angina. But remember, Prinzmetal's angina means it is occurring at rest, or it can happen anytime. Next one is nocturnal angina. Now nocturnal angina means it is occurring at sleep, only at night. Next one is angina decubitus. This is the chest pain that is happening when you are lying down. Okay, and it will be reduced while you sit or while you stand. Already I told you the reason, isn't it? While you're lying down, what happens? You are most of the time the gravity is redistributing the fluids in the entire body. Okay, and the heart will have to work harder in order to pump the blood. Okay, and because of that, what will happen? The blood flow will be restricted, cardiac output will be less, and heart will have to work harder. Okay, and because of that, suddenly there can be chest pain in the patient. Next is intractable angina. Now intractable angina is one type of angina which is not at all responding to any sort of treatment. Okay, it is a type of chronic angina. Okay, unresponsive to any treatment. Post-infarction angina means usually this is the chest pain that is seen after myocardial infarction or after heart attack. Now after heart attack, slowly the patient may be recovering, but because of the ischemia, there is certain amount of ischemia or necrosis in the heart, isn't it? Because of that ischemia, again they are getting episode of chest pain, that is called post-infarction angina. The last one is silent ischemia. So as the name suggests, silent. Here the patient will not have chest pain. Okay, there is absence of chest pain, but when you do a ECG or when you do a stress test, you will see that there are changes. Okay, that is called as silent ischemia. Okay, the cause for it is unknown, but usually your patient will not complain of chest pain, but the readings will be abnormal. ECG reading, stress test, and other readings may be abnormal. Now in this chart I have given the difference between stable and unstable angina. As I told, stable angina is episodic, but unstable is actually very severe, and it is unpredictable. Already I told, isn't it? While stable angina was predictable, it was because of a predictable degree of exertion. Unstable is unpredictable degree. Okay. Then stable angina occurs most of the time because of exercise, physical activity, and immediately once you take rest or once you take nitroglycerin, it will reduce. But unstable angina, it can occur anytime. And even if you take rest or even if you take nitroglycerin, it is less responsive. One more difference is stable angina can be less than 5 minutes. Okay, unstable angina can be seen for 10 minutes or sometimes up to 15 minutes. But always remember, the myocardial infarction or heart attack which is there is seen for more than 10 to 15 minutes. Okay, it is more severe one. Okay. Now moving on to the etiology of angina. So we have studied already so many modifiable, non-modifiable factors and all. No, same thing you can write here also if you cannot remember the exact etiology, because that is also correct one. Okay. So always remember age. Angina affects mostly the aged population. Those who are more than 45 years, 50 years commonly suffer with angina. Okay. Now in gender it is seen that men are affected. Okay, but women will be more affected after the menopause. This already I have explained. What happens after menopause? Estrogen will be less, and that is actually a protective hormone. So once this menopause occurs, women also will be equally at risk of any cardiovascular problem. Next main cause of angina is atherosclerosis or coronary artery disease. What is atherosclerosis? A plaque deposition or atheroma or fat deposition in the blood vessel or coronary artery. And most of the time this angina can be because of coronary artery spasm. Okay, already I told in Prinzmetal's angina, the main cause is coronary artery spasm. Sometimes angina can be because of heart failure, okay, or congestive cardiac failure or congestive heart failure. Next is cardiomyopathy, where there is problem of the heart muscle. Valve problems, maybe stenosis is there in the valve. You know the valves, isn't it? Heart is having valves, AV valves are there, semilunar valves are there. Next main cause is hypertension and diabetes. If you have hypertension and diabetes, the risk of developing angina also increases. Okay. So try to remember, in this slide we are having all the cardiac problems. Okay. So all the cardiac problems may be resulting in angina. Okay. Next is moving on to non-cardiac causes. Now these are actually respiratory causes. Okay. Now you may wonder why respiratory causes are again resulting in chest pain, isn't it? Now what happens in asthma, pneumonia, COPD, bronchitis? In all these respiratory conditions, there is hypoxemia, that is decreased oxygen supply. What will happen when there is decreased oxygen supply? There will be usually less cardiac output, isn't it? So because of that, the heart has to work harder in order to pump. Because of that, what will happen? Increased workload on the heart, that will trigger chest pain. Next one is anemia. We know in anemia there is less amount of red blood cells and hemoglobin. The oxygen carrying capacity itself is less. So what will happen now again? In case of anemia also, there is more and more workload on the heart, that will trigger chest pain. When there is low blood volume also, it is the same reason. Okay. Next, few other factors are there which will increase oxygen demand. In all these factors, oxygen demand is more, okay, but supply is less. Okay, for example, when you use drugs, or when you are having high temperature, hyperthermia, or when you are having hyperthyroidism, or when you do exercise, or after a heavy meal, what will happen? The need for oxygen is more. The demand here is more, but supply is less. So what will happen? It will trigger chest pain. Okay, that is after taking drugs, after high fever, because of increased thyroid hormones, physical exercise or physical activity, and heavy meal. We know after heavy meal also what happens? All the blood will be moving towards the digestive tract for the digestion, and supply to the heart becomes reduced, isn't it? So heart has to work harder to pump the blood. Okay, so that may cause chest pain. Next is moving on to some triggering factors or precipitating factors. Now these precipitating factors, what happens is immediately after getting exposed, the person can suddenly get heart attack. So the precipitating factors are, first of all, physical exercise. Suppose a patient has gone for exercise, heavy exercises I am telling, okay, very heavy strenuous exercise, or for very long period of time they are working under or they are working in a gym, or under the sun where they are fully sweating. What will happen in this case also? Suddenly there can be decreased cardiac output. Heart has to work harder. Okay, because of that, patient can experience angina. Next one, very most important triggering factor is temperature extreme. Now, most of the time we have seen that heart attacks or chest pain occurs when there is very cold temperature or very hot temperature. Okay, for example, in the bathrooms, have you seen the heart attacks that occurring in the bathrooms are more? Because what they do is, very some people have the habit of taking bath in very cold water, even in very cold temperatures, and some people have the habit of taking very hot bath in cold temperatures also. Okay, or even in hot weather. So what happens is, when you are exposed to very extreme type of temperature, chances are there that you're also, that will reduce your cardiac output and heart may have to pump more. So that may cause chest pain. Next one is strong emotions, that you are already aware, isn't it? When you are exposed to stress, okay, or because of anger, anxiety, or any saddening news, that also may trigger heart attacks or chest pain. Next is heavy meal. This already I have told. When you take a large heavy meal, what will happen? All the blood circulation goes to the GI tract for the digestion, and your heart will receive less amount of blood flow, less cardiac output. So what the heart will do, heart will think I also have to pump and get more blood, and it will try to work hard and hard. Finally, it will result in chest pain. Next important precipitating factors are taking tobacco. Already I have told what happens when you take tobacco, what happens when you do cigarette smoking. It is having nicotine that will damage endothelium and it may trigger heart attack. Okay, it is not that once or twice you are doing it will result. Most of the time people who are 10 to 15 years, 20 years of smoking or tobacco intake, these people commonly get heart attacks or chest pain. Next is stimulants. When you take lot of cocaine, lot of coffee, those some people have the habit of drinking 4, 5 or 6 glasses of coffee. We know coffee is a stimulant. It has lot of caffeine. Okay. Next is sexual activity. Nowadays even we have read in the newspapers, isn't it? During sexual intercourse also chances are there that person can suddenly have a chest pain or heart attack. Okay, because of the stimulation here. Okay, because of the vasoconstriction to the heart, suddenly workload may increase on the heart. Next important factors are people who have diabetes mellitus, people who have hypertension. Okay, then there are some other non-modifiable factors like family history, genetics, aging. Okay, that also will be a triggering factor for what? Chest pain. Next is obesity. This also we have discussed. Fat accumulation around the abdomen. If you consume more amount of fats, saturated fats or oils in your diet, what will happen? There will be increased cholesterol that can result in hyperlipidemia. So you will be at risk of developing angina or heart attack. Even people who have got thyroid or kidney disorders. Next, we will move on to the pathophysiology, very important and very easy also. Now, my pathophysiology, which I have written here, looks very lengthy. Okay, you need not write so much. Okay, you can just mention due to etiological factors and write down some of the etiological factors or risk factors. Okay, what I have written here is you should always remember there should be a balance between the myocardial oxygenation supply and there should be a balance between the demand. Okay, so there should be equality between the oxygen supply and oxygen demand, isn't it? So if your supply is less or if your demand is more, what will happen? There will be imbalance. Okay, so that is what I have explained over here. Need not go to bother about this thing. Just mention due to etiological factors. You can write down some of the etiology like hypertension, DM, cardiomyopathy, coronary artery disease, heavy meal, exercise. Okay, all that what will happen? It will result in imbalance in oxygen supply and oxygen demand. Okay, because of the etiological factors, there will be imbalance in the oxygen supply and oxygen demand. Now, what will happen when there is insufficient blood flow? What will happen? Here there is imbalance in supply and demand, no? So, what happens to the myocardium? It will receive less amount of blood flow. Okay. What happens when there is decreased blood flow? That is called as myocardial ischemia. Okay. What is myocardial ischemia? Nothing but there is hypoxia. There is decreased oxygenation, isn't it? Decreased blood flow means what? Decreased oxygenation to the heart, isn't it? Next, what will happen is normally, you should remember, normally what happens is during metabolism, there will be aerobic metabolism, isn't it? Aerobic metabolism occurs. But here, because of non-availability of the oxygen, because of decreased oxygen, it will convert aerobic to anaerobic metabolism. Okay, so here what happens? Normal aerobic mechanism is not there. Instead, anaerobic metabolism will start. And what is the end product of anaerobic metabolism? The end product is lactic acid. You might have studied in biochemistry. So the end product will be lactic acid, and always remember when the end product is lactic acid, it will result in pain impulses and it will cause chest pain. That is the pathophysiology of angina. Mainly you should remember here is there is imbalance in the oxygen supply and demand that will cause myocardial ischemia and that will result in what? Decreased blood supply, that will cause decreased oxygen supply. So the normal aerobic metabolism is converted to anaerobic. In anaerobic metabolism, what will happen? The end product is lactic acid. That will cause the pain impulses or chest pain. Okay, you can just go through the note that I have given here. What I have explained already, only it is there in this note. Okay, so remember, myocardium will become hypoxic within 10 seconds. Okay, within 10 seconds of obstruction, myocardium will start to become hypoxic, and then there will be ischemia, decreased blood flow, decreased oxygenation. Okay, so because of that, it is converted from normal aerobic metabolism to anaerobic metabolism. Next, we will be moving on to the clinical manifestation. So before starting, we'll just discuss this figure. So normally in chest pain, okay, anginal pain, patient may have pain in the retrosternum, in the upper chest, and pain may also radiate towards the jaw, towards the neck region. Sometimes some patients will complain that the pain is radiated to the left arm. Some patients also have epigastric pain, slightly lower, okay, just above the upper abdomen. Some patients may tell that epigastric pain is there. Along with that, it is radiating to the neck, jaw, and arms also. And some of them also complain that it has radiated from the jaw to the clavicles and then into the shoulder and even to their fingers. Okay, so remember, the clinical manifestation of angina is first of all chest pain. Okay, so many features or characteristics of chest pain I have explained. Please go through that and write that. So chest pain here is, patient will tell it is not mild or moderate type. It is very severe. Squeezing, the patient will just hold the chest and squeeze. Okay, pressure will be there, heaviness like chest pain, tightness will be there, or burning type of chest pain will be there. Okay, and patient will just may scream also suddenly. Then this pain is usually radiating to the jaw, neck, arms, and even to the shoulder, sometimes to the back or through the throat. Now the onset of the chest pain is either it is quick or slow, and location, first it starts in the retrosternum. I already told how it radiates. It radiates to the neck, jaw, left shoulders, upper arm, then travels to the wrist and to the fourth and the fifth finger. Okay, last it travels to fourth and the fifth finger. Some patients also complain of slight pain in the right side. Okay, right shoulder, neck or jaw, and even to epigastric region. So this is the typical distribution of the angina pain. Duration, already I told, the anginal pain will be usually for less than 5 minutes. If unstable means only then for up till 10 minutes. Okay, remember that MI is only the one, or heart attack is a one type which results in duration for a longer period of time. Okay, pain will be there for longer period in MI. Now here in anginal pain, the severity is mild to moderate, but even though it is mild to moderate, they will be having a strangulating or choking type of a pain. Okay, very much tightness in the chest they will feel, as if they are going to die now. Such fear they will be having. Other clinical manifestations are, now already I told us one main thing is about chest pain. Remaining things are related to the respiratory system. Okay, so they, because of the hypoxia, they are getting dyspnea, shortness of breath. Why there is dyspnea, shortness of breath? Because decreased oxygen to the lungs. Okay, chest heaviness, fatigue, pallor. Okay, even cyanosis may be their last stage. Then, because of decreased blood and decreased oxygen to the cardiac or the cardiovascular system, patient may have sudden fainting. Okay, sudden dizziness may be there. They will be sweating a lot, that is called diaphoresis. Palpitations, feeling of one's own heartbeat, beat. Arrhythmias may be there, that is abnormal heart rate and heart rhythm. Changes in the ECG. Now here particularly ST segment may be elevated or either depressed. Okay, that is commonly we see in MI. Okay, that we will come and we'll see in myocardial infarction. Next is anxiety is very common. Okay, so remember, oxygenation to the brain, to the heart, to the lungs is also reduced. So that is why what happens, patient is experiencing these symptoms, that is fainting, diaphoresis, palpitations, anxiety and ECG changes. Next is, even there is decreased oxygenation to GI system and to the skin. Okay, so because of that, how the skin will be, it will be cold and clammy to touch. Patient will have pallor, and most of the time it is seen that some patients will have nausea and vomiting during chest pain. Remember that. Okay, commonly in heart attack it is very much seen. Next is urine output. Decreased blood flow to the kidneys may result in urine output, and sometimes it is also indicating cardiogenic shock. How to diagnose angina? Already we have seen. First of all, correctly collect the history regarding the diet, okay, or occupation. Thorough head to foot physical examination should be done. Through ECG, what we can do, we can find out any changes in the heart rhythm. We can monitor the electrical activity of the heart, okay, changes in any of the waves. Echocardiogram, it is a procedure that is done to record the mechanical activity of the heart, okay, that is ultrasound of heart. Chest x-ray can be done, okay. Commonly we will go for cardiac catheterization or coronary angiography, isn't it? What they are doing there, they are seeing which of the coronary artery is obstructed or blocked by injecting the dye. Stress test is done. Why we do stress test? To know what extent the heart is able to pump, okay, or what type of stress the heart can usually maintain, okay. Next is Holter monitoring. Holter monitoring also I have already discussed in the class. So this is a figure of coronary angiography which we have already discussed. This is a cath lab room. Remaining things is blood investigations will be done, okay, and the urine examination can be done. You can collect complete blood count, cardiac enzymes can be collected, okay. Then thyroid function test, liver function test, renal function test, blood sugars, lipid profile, all this can be collected, okay. We can also go for MRI, CT scan and PET scan.